Hello, everyone. I think we'll go ahead and get started now. Welcome to Expecting Health's webinar on coming together to support communities, supporting families during the COVID-19 pandemic and beyond. My name is Annie Evans, and I'm a program development specialist with Expecting Health, and I'll be hosting today's webinar. A few notes on logistics before we get started. This webinar is being recorded, and a link with captions will be available on Expecting Health's YouTube channel by the next week. ASL interpretation is available on this webinar provided by Adeline Riley. You'll see her video pinned off to the side if you need that service. Please submit any questions that you have in the chat box throughout the webinar, but all of our questions will be addressed at the end of the webinar during a Q&A session. If you do need IT or technical assistance, please feel free to use the chat box at any time to message us about any questions you have. A note on our funding disclosure. This webinar is being supported by the Health Resources and Services Administration, or HRSA, through the Newborn Screening Family Education Program, which is run by Expecting Health. So a little introduction to Expecting Health, for those of you who aren't familiar with our work. Expecting Health is a team of key leaders in health communication and pregnancy and pediatric health who bridge actionable information with the everyday realities of women's experiences and family lives. What does Expecting Health do? We provide actionable, relatable science by bridging science-based information with health literacy to create relevant, accessible, and actionable messaging. We advocate by working with legislators, organization leaders, and other decision makers to ensure that policies, funds, and guidance match the needs of communities. We also build coalitions and lead collaborations between scientists, health providers, and people affected by those decisions. We create trainings, build connections, and do technical assistance. A few notes on our learning objectives for today. We will hear about COVID-19 support services for families that are available right now. We will learn about COVID-19 supports that are available long-term, and we will find opportunities to build partnerships to meet family needs. So now we'll get into our agenda for the day. I will speak first about some COVID-19 informational resources available from Expecting Health. Then I will pass the torch to Candice Lindow-Davies from Hands and Voices, who will share family feedback from their organization's open office hours for families with children who are deaf or hard of hearing. And last but not least, we will hear from Cure SMA's Dr. Mary Schroth about providing SMA direct support to families during the COVID-19 pandemic. And we will close out with a Q&A session, which will be moderated by me. So now I will run through some resources from Expecting Health. So one of our resources many of you will be familiar with is Baby's First Test. For those of you who are new to this community, Baby's First Test provides information for families and healthcare providers on newborn screening. And newborn screening is a public health service that checks babies for a number of rare health conditions at birth. On Baby's First Test website, you can find updated information on what to expect from newborn screening, family experiences with newborn screening if you're interested in learning about family stories. You can also find details on state newborn screening programs, including policies and what conditions are offered on those state newborn screening panels, as well as information on 78 different newborn screening conditions, as well as educational resources like materials or handouts, as well as additional recorded webinars if you're interested in finding more information. You can also check out our interactive national map, which is shows a map of all the various conditions that are screened through each state's newborn screening program, as well as public squares, which host some discussion on newborn screening topics, and links to our social media so you can follow along on updates. As updates to state services related to COVID-19 occur, you'll be able to find updated information on Baby's First Test website, as well as other information. Newborn screening has and will remain available to families throughout the COVID-19 pandemic. So families need to know that they can still get the essential information on the health of their child right now. Again, you can follow along on Baby's First Test newsletter and social media for news and resources related to COVID-19 and newborn screening. Another resource that is useful to note, families can also access Expecting Health's Navigate Newborn Screening educational module for guided learning and skill building. Navigate Newborn Screening is a free online educational module for families where they can learn, connect with us as well as other organizations, and gain the skills that they need to advocate for themselves and others. Very soon, we will be launching a module with information on COVID-19 and newborn screening, so that will be accessible very soon. And we encourage you to get signed up on our listserv if you haven't already, if you'd like to be notified when this is available. Navigate newborn screening is really an awesome way to learn while staying safe at home. We know a lot of families aren't able to make it to their healthcare provider appointments where they might usually have learned about newborn screening. So this is a great way that you can really get some validated and guided information online, safe from your couch. So what other information is available from Families from Us? You can check Expecting Health's website for general COVID-19 information for families, particularly new and expecting parents. We have some articles on newborn screening and or COVID-19 and breastfeeding as well. You can also, and as I mentioned before, you can check Baby's First Test, new COVID-19 and newborn screening page for some basic information on considerations for newborn screening during this time. So now I'd like to share some key messages that Expecting Health has been working on for families during this time. This is really what families want to know about newborn screening and COVID-19 during this pandemic. They really want to know that newborn screening is still available for them. That's a really important point. They need to, families need to know what services they can access, and as well as they need to know that healthcare facilities and teams are really taking precautions to protect them so they can safely access those services. Expecting Health has developed a number of messages and resources as well as graphics for social media on these issues. So you can stay informed on our social media, but for the professionals on this call, if you're interested in partnering with us, you can reach out and we can work together to provide you support with those communications or customizations of the graphics and messages that we've already developed. So please feel free to get in touch with me if you're interested in that. Great. So now I'll be passing it over to Candace Lindow-Davies, who is the Director of Outreach from Hands and Voices. So,
great.
Candace.
Thank you, Annie, and thank you for the invitation to the session today. I'm honored to have the chance to talk about Hands and Voices and our efforts to support families during the COVID pandemic. And for a little bit of background about me, I'm first and foremost the parent of 2 adult children, one of whom who is deaf and has other health concerns. And that experience led me as a mother to become the founder and executive director of Minnesota Hands and Voices. And just over 3 years ago, I left that position to become the director of outreach for Hands and Voices headquarters, where I am now. But before I launch into sharing how Hands and Voices have been rising to meet the challenges of COVID, I'd like to give you just a little bit of an overview about Hands and Voices in general. Next slide, please. Oh, actually, next slide. All right. Hands and Voices is a nonprofit parent organization supporting families with children who are deaf and hard of hearing, or DHH. We have 42 chapters in the US and Canada. Hands and Voices offers 3 formal programs. We have many projects and other services, but 3 formal programs. The Guide by Your Side program, which is a team of trained parent leaders who provide support to families with children who are deaf and hard of hearing. Some of our guide programs actually have deaf and hard of hearing adults who provide role model services as well. We also have the ASTRA Educational Advocacy Program and the L2L, or Parent Leadership Training Program. Hands and Voices headquarters is the recipient of a cooperative agreement through the Health Resources and Services Administration, HRSA, titled Family Leadership and Language and Learning, or the FL3 Center. This center is responsible for providing technical support to national, state, territory, and local early hearing detection intervention EDI systems of care. The project's goals are to increase family engagement and leadership and to strengthen family supports to families, parents, and caregivers with newborns, infants, young children up to age 3 who are deaf and hard of hearing. And so through the FL3 Center, Hands and Voices has expanded our work beyond our own chapters to other family leaders and other family-based organizations who provide support to children who are deaf and hard of hearing. So next slide, please. And as the pandemic unfolded, Hands and Voices FL3 team really started creating ways to respond to the emerging needs families were experiencing, and also to support family leaders and family-based organizations, or FBOs as we call them. Here are some ways that Hands and Voices headquarters provided support. First, we created a webpage just packed with COVID-related resources, both in English and Spanish, and these are continually updated weekly. We provide technical assistance to family leaders and family-based organizations around COVID-related issues. And then we really expanded the work we were already doing. For example, we offered webinars, but we had one webinar that focused on Hands and Voices Hour project, which is the prevention of child abuse and neglect. And in this case, you can see in the graphic, we really focused on strengthening the protective factors surrounding families during stressful times. So next slide, please. Another example of expansion of existing services is our FL3 Office Hours. FL3 has offered office hours since 2018. And really this is bringing together family leaders and FBOs around different parent support topics. So staff training, or providing unbiased support to parents, or quality improvement projects, language and literacy tools, and so on. And we've also offered those office hours separately to our Pacific Island EDI systems at a time that worked for them, and also address some of their unique needs as well. But again, as the pandemic unfolded, we used that office hours model to offer weekly sessions specifically to COVID-related discussions, really for those parent leaders working directly out there with families. And the format was pretty simple. We talked first about identifying parent concerns and issues, and we shared ideas for successful strategies and provided encouragement and peer support to family leaders who are experiencing those same challenges. And then we always ended by sharing some upside stories, some examples of the silver linings, the kind acts, the improvements that are being made that will be changes that will be ongoing. And then we also offered separate COVID office hours for the Pacific Islands as well. Next slide, please. So from those office hours discussions, our parent leaders shared challenges that parents were experiencing. Things like basic needs, financial, food, transportation. And really for our demographic in particular, social isolation of that child. Because when children are brought into a center and they're able to socialize with other deaf and hard of hearing children, because this is a low incidence occurrence, deaf and hard of hearing is, when they're pulled back to the home, they're very isolated. And then the parents are also isolated from other parents who have deaf and hard of hearing children. We heard stories about, screening and diagnostic appointments either being halted or limited, and the stress that this was putting on, especially new families that had just been told their child had a screening that needed follow-up. There was lack of technology for the families. Access to online learning was challenging. There's even just challenges with the child's ability to attend to online learning themselves, or having to use an interpreter in an online situation for the first time. That classic situation of, parent juggling work as well as attending to the child's learning. Lack of language models for children, because if you have a child who's deaf hard of hearing, for example, and they use American Sign Language and they had native ASL users in the school setting, now they're at home, they're not experiencing that same access to native language users. And so some families were reporting regression of their child's progress as a result of being at home. And then there was just kind of this growing fear and disinterest around teletherapy. Even though the teletherapy services maybe were available, families were just burnt out. They were just overwhelmed and overscheduled and had so many demands on their time. And then now it's kind of turning a bit towards more that fear of returning to school, especially for medically fragile children. Next slide, please. So from those FL3 office hours, we learned what strategies parent leaders were implementing as they moved away from pre-pandemic services like home visits and in-person trainings and presentations to new models. So some of the examples were doing their own compilation of COVID-related resources for families. They were making calls to medical providers and audiology offices to find out if the services were being available or advocate for families. Some did surveys of parental needs and then shared that information, say with like early interventionists, to find out what the needs of families were. Family organizations and parent leaders were continuing their outreach or maybe increasing their outreach to newly identified families to provide support, but through virtual means now, so phone, video conference, and so on. And then we had parent leaders providing information about clear masks, for example. You know, clear masks are scary for children in general, but they become a barrier for deaf and hard of hearing children without access to watching lips and also for muffling the sound for those who use auditory. So they were sharing information about workarounds for that. Some parent leaders were also providing mental health support and parental self-care tips, really to help bolster their resilience. We had parent leaders showing uplifting positive messages on their social media, such as the Fostering Joy Project from Hands and Voices headquarters, pictured here in this graphic. And a lot of new collaborations were being formed between parent organizations and early interventionists and deaf organizations. It was really exciting to see that coming out of this. And then we also saw family-based organizations were providing their own emotional support to their own parent leaders who are doing that frontline work and transitioning from in-person trainings to online trainings as well. And in the next few slides, I'm going to share a little bit of some of the creative ways that parent leaders have been working to replace the benefits of that in-person community that has historically happened. You know, those benefits like, you know, that informal exchange that happens between parents, sharing wisdom and strategies, you know, just at a training or a social event. Those connections that happen between peers and siblings, the self-esteem and confidence that comes with in-person meetings with deaf and hard of hearing adults. So these were some ways that the family-based organizations and parent leaders were switching to virtual means. So here, the Sunny graphic, that's from Georgia. They were providing support through Facebook chats. The 3 C's, come with your concerns, connect, make connections, and some laughs through comedy. They also were offering sessions on literacy, and they were hosting sessions for families whose first language is Spanish. The other graphic here is from Minnesota, who had an entire year of in-person offerings for educational advocacy, and then had to move to an online platform to offer that specifically for deaf and hard of hearing. Also in Minnesota, they have deaf and hard of hearing adult guides, and so they were hosting online activities and story times for kids as well. Next slide, please. The self-care event, that comes from Oregon. They did one for parents, and then they have been doing adorable online home craft activities led by a parent guide and their family. And those videos can be found on their Facebook page. They're just really cute. And then the other graphic is from Washington, and they did a parent caregiver social hour. These are intended to be peer-to-peer supports around topics like well-being and knowledge and empowerment. They also offered online playdates, really to increase that interaction between children who are deaf and hard of hearing. And the playdates, they would weave in educational kind of components to it too, resiliency, empathy, social skills, things like that. So great examples there. Next slide. And then here's 2 more. The one, the Thursday 30s, comes from Kentucky, where they invited professionals to talk with parents about different topics. They even had an event where deaf, hard of hearing kids interviewed an adult, talk about developing real long-term great skills. That was a great example. And then the graphic on the right is from Texas. Texas is prolific with their posts and activities. I'm quite used to spanning large distances, and so they've really always taken advantage of online platforms. But in this case, they developed Tuesday topics, and this session in particular was around parenting deaf and hard of hearing kids. So a great way to see more examples of this is to go to any of our family-based organizations' Facebook pages and scroll back and see all the offerings. This is merely the tip of the iceberg for what's been offered. And it's really been moving to watch how innovative they've been and how creatively they've really woven in educational tools into their activities. Next slide, please. So those are just a few examples of the innovative ways our family-based orgs have been rising to meet the changing needs of our families with kids who are deaf and hard of hearing. And I'll toss it back to Annie, and thank you for listening.
Great. Thank you so much, Candace, for sharing those strategies with us. So now I will be passing it to our next speaker, Dr. Mary Schroth from Cure SMA.
So to introduce myself, I'm Dr. Mary Schroth. I'm a pediatric pulmonologist, and I currently work as Chief Medical Officer for Cure SMA, a nonprofit organization based in the Chicago area. I am not seeing my slides.
Sorry, just a moment, Mary. We'll pull those
Okay,
up.
perfect. So we're going to tell you a little bit about what Cure SMA typically does, and then how we've changed our programs in response to COVID. Next slide. So Cure SMA is the largest patient advocacy group focused on SMA in the US. We fund and direct comprehensive research that drives breakthroughs in treatments and care. We were established by a family with a child with SMA back in 1984. We provide vital support services for families living with SMA. We currently have 36 chapters that are volunteer-led, and they're the face of our organization on the ground. We have approximately 120,000 families and supporters involved with Cure SMA, and that's our website. Next slide. Spinal muscular atrophy is a rare inherited progressive neuromuscular disorder with approximately 10,000 individuals impacted by the disease in the US. We've had the success of our research programs resulting in 2 FDA-approved treatments. SMA was also added to the recommended uniform screening panel 2 years ago. We're celebrating the anniversary this week. And currently, 60% of all infants born in the US are screened for spinal muscular atrophy. And progress in implementing SMA into newborn screening programs throughout the country have continued despite COVID-19, and we're so pleased about that. This is a photo of a child who is showing off a newly diagnosed package. The key for what we offer families is information about spinal muscular atrophy. Most families whose child is diagnosed with SMA have never heard of it before. So we feel compelled, and one of our strongest things that we offer is just information about what SMA is. And we provide the newly diagnosed packages based on what a baby would need or what the newly diagnosed people. Prior to newborn screening, people are diagnosed in infancy, in childhood, and also in adulthood. And we have newly diagnosed packages for every individual. They're customized. We have information packets about the disease. We offer wagons to families with newly diagnosed infants. We also have an equipment pool offering things like bath seats and strollers and different equipment some might need. As our population has survived longer, we have a larger and growing teen and adult support, teen and adult population, and we've developed support packages for them also. Next slide. So again, just to talk a little bit more about our newly diagnosed care packages, they're sent to every family in the US. We also send internationally, but not the package. We send the information in a USB drive. So we also have a newly diagnosed finder that provides a way for people to track their medical information in one location. And we also provide a list of resources in the state that they live in. Next slide. So one of the coolest, I think it's one of the coolest things that we offer is an annual SMA conference. This was at one of the Disneys a couple of years ago, where we orchestrated a photo with many of our attendees. And I just love this photo. Next slide. So our annual conference actually consists of several parts. Family conference is the biggest. It's the largest family-focused single disease conference. And we also offer scholarships to families for newly diagnosed families. In parallel, we have a research meeting and clinical care meeting for researchers and clinicians, and it is kept separate. But then we gather in the evenings to do joint social events. And in 2019, we had 2,500 attendees. Next slide. Another program that we provide is something called the Summative Strength. These are one-day programs that we offer throughout the US. We did 36 programs between July of 2018 and November of 2019, just different communities throughout the country. They're free programs. We have sponsorships from our partners, but they're really focused on providing information and supporting conversations and community. Next slide. And then COVID happened. COVID-19 completely altered some of the work that we do. As a small community, being able to gather and share is cornerstone for us. And when COVID became a pandemic that was not going away soon, we sought to provide resources to continue to keep the SMA community together and safe. And in the SMA community, it's very typical that families go into what we call lockdown during the winter viral season, avoiding others who are sick, using hand sanitizer, just avoiding being in the community and avoiding exposures. And the expectation is that that viral season will end in the spring. However, this year, viral season was extended, and COVID-19 is so much more contagious than our typical flu. And as a result, we developed an information center, this webpage. So on the left is our homepage, and it offers you a link directly to the COVID information page. And on that information page is a tremendous amount of information. We use the CDC guidelines as a base for much of our information, but then modified it to best fit our community. Next slide. So the resources that we've offered we've had community webinars. We've had 2 family community webinars, which includes the entire community, including health providers and researchers. We've provided 2, and we're looking at our next topic area as we transition into going back to school and how to best manage that. We offered a newly diagnosed program. We also offered a healthcare providers panel, bringing together experts from around the country to talk about various aspects of healthcare delivery, including telehealth, and how to keep families and individuals with SMA safe when they enter a healthcare facility. Within the COVID-19 Information Center, there's letters supporting home-based work or school that families can use with their employer or with their schools, and letters for families to share with healthcare providers, talking about the importance of continuing the SMA treatments that are currently available. We have letters for families to advocate to payers to allow flexibility, for example, for the very expensive and disease-modifying therapies that are available. There are criteria that patients have to meet. They have to be evaluated by a physical therapist to demonstrate stability and or improvement, and that's just not been feasible to see a physical therapist to do those sorts of assessments. And so we've advocated to payers directly and have provided resources for families to also advocate to payers and for healthcare providers to advocate. Next slide. One of the really cool things that we've offered are these support packages. So we developed a COVID-19 support package, which you see on the left, and launched that. And along with that, we asked families to complete.
I believe we may have lost your audio for a minute, Mary. We'll give her just a second to reconnect.
Are you able to hear me?
Yes.
Okay, great. So I was just talking about the resource, the COVID-19 resources that we've been able to provide due to generous sponsorships. We have sent out 1,500 of the COVID support packages. As part of those packages, we have asked families to provide us with feedback about the impact of COVID-19. On the right-hand side of the slide, we more recently introduced a COVID-19 assistance program, which provides a $50 gift card to help with purchasing things like meals, groceries, other essential supplies. We provide one per household for these items. And we've provided 850 so far, the COVID-19 assistance program items. Next slide. We've also converted our Summative Strength program, which is the one-day event that we used to take the program to the community, And now we've converted it to topic areas that we present virtually, just like this meeting. So we've covered topics like supporting emotional health during these very uncertain times, discussion of nutrition, and discussion of physical therapy at home. We also converted our typically 4-day virtual SMA conference to our annual SMA conference to an all virtual, and ran that over 5 days, selecting topics of particular interest to offer to families, and then also held a more limited version of our clinical and research meeting. And knock on some big wood, those went off very well, and we're so pleased. Next slide. So I just wanted to share with you briefly the impact that we saw from our community, the feedback that our SMA community has provided back to us. 1,500 people responded, 65% were parents, 32% were self-reports. Next slide. And what we heard back was that 37% of families experienced cancellation or delayed appointments. These were cancellations by their healthcare provider for a follow-up appointment. 20% of families reported that their SMA treatment was canceled or delayed. The 2 current FDA treatments require administration in a hospital or outpatient clinic setting as they're given IV or intrathecally. That response led us to really advocate strongly with healthcare providers to not delay or cancel those appointments, and to make it feasible for families to receive these safely as quickly as possible. 50% of our families reported that they had difficulty accessing services like physical therapy and home-based services. 34% reported that they had lost their job or their working hours were reduced. 2/3 of our community reported significant financial impact from COVID-19. We were very pleased to learn that only 5% of our population either were diagnosed with or were exposed to COVID-19, and 0.1% were hospitalized. And I think this really speaks to the lockdown phase that the SMA community goes into during viral seasons, and they've continued to do to continue to be in lockdown mode. Next slide. So new programs that we are offering, and
no, I think we may have lost Mary briefly again. While we will, we'll pause just for a moment to see if she can join us back again. Mary, would you like to finish saying the last few words on your presentation? I think you were nearing the conclusion of your thoughts there.
Yes, thank you so much. So new COVID-19 programs that we are looking at are offering community social events so that our community can connect again. That has been so important for us, as for most of our communities. We're also looking at additional Summative strength topics for the community. And we're trying to sort out for the SMA community the transition to school and what that will look like. And as everyone on this call knows, we're just in such uncertain times. I think we're struggling to predict the best way to manage. So thank you so much for the invitation to present and be part of this program. I look forward to your questions.
Great. Thank you, Mary, so much for your thoughts today. And thank you for your perseverance through some connectivity issues there. So we do appreciate that. So at this time, I will be doing a little bit of moderated Q&A. So I will go to some of your questions that you sent through the chat, and I do appreciate all of you having your patience with your patience for us to get to these questions. I will also ask that during this time, if several of you are thinking about, if you've been thinking about the topics that we've discussed so far, please tell us in the chat ways that you think you could be using some of the information that you presented here. So I'll go to the first question that we received towards the start of the webinar. And I believe there was a question for Candace on how family needs and concerns were identified in the FL3 office hours. Was there an intake process?
Yeah, thank you. This is Candace. Thank you for the question. So just to go back, the FL3 Office Hours was a discussion for family leaders, typically from family-based organizations. So those family leaders themselves had been working directly with families. And I think there were one of two ways that they gathered those concerns. One was through surveying their parents. And so there were some surveys that were sent out and completed. And so those parent leaders were coming to the discussions with actual, the survey results. And then just our parent leaders were sharing also just anecdotal information as far as their growing concerns and what they were dealing with, what the questions were that they were coming in from parents. So it was both informal and a little bit more formal. I don't know how formalized the surveying was, though.
Great, thank you for answering that. Another question for Candace. Can you speak more to the disinterest in teletherapy that you mentioned? Was this largely due to online burnout, and has this changed at all now that school is out?
Yeah, thank you again. This is Candace. I think it was twofold. I think one immediate barrier was technology, having access to technology by the family side to try to link to, or education around how to use that technology to access teletherapy. So actually some of our family leaders were helping families learn how to use the platforms that they were going to be engaging in when they were doing teletherapy. So technology did have a role in it, at least early on. And then later we had reports from families that were just overwhelmed. So I think it was two of those things happening. And I think that's a really good follow-up question. And actually our FL3 COVID-related office hours stopped and we resumed our regular office hours again in May. So I don't know what the feedback is after school now has let out. I'm hopeful that those teletherapies are being accessed more so because of not having so much to schedule during the summer months. But that's a very good question, and thank you for asking. I'll be following up on that.
Great. Okay, so the next question we have here is for Mary. How are you notified of newly diagnosed SMA cases in the US? Is there a consent required?
So families contact us in order, so we work through healthcare providers and we have communications with the state labs, but we don't reach directly out to families for a first contact. They reach out to us.
Thank you, Mary. Okay, so a question for both Mary and Candace here. Are you seeing an increase in severe illnesses of COVID-19 negative individuals within your communities?
This is Candace. I know Mary had shared some statistics earlier. I don't have that data at my fingertips, so I don't know. I have not heard through the parent leaders of an increase, more so than usual. I think a lot of our families have been on lockdown, but I don't have that data available myself.
Hi, and this is Mary. So we are not seeing more, I just want to make sure that I'm clear. So related to COVID type infections, we're aware of 4 families who've experienced COVID infection. And based on our statistics, very low. And we are not seeing more severe illness or hearing about more severe illness.
Well, thank you both for that, for those answers. And perhaps if I think that was Shelley Bowen that asked that question. So if you're interested in following up on that, please feel free to reach out to us and we can continue to discuss that and point to some resources once we've had some time to do a little research. Okay, so the next question is actually for me. So thanks, Susan, for getting in touch. When it's time for, how has NBS been impacted by COVID? Are there delays in getting screens back? Are parents still having NBS done and following up? In Washington State, for example, our second screening, which is done at 2 weeks, isn't always being done as a result of COVID. Overall, is NBS continuing to happen as it should be? So I believe that Amy Gaviglio, who's one of our consultants at Expecting Health, helped answer this question a little bit. But for the group as well, generally, what we've heard here is that NBS is occurring as it should be, although there have been some shifts in the staff that are performing newborn screening, which does sometimes relate or mean there are some miscommunications or like differences in protocols. So there have been some shifts in the staffing, which has created some some issues. But as always, Babies First Test and Expecting Health and Navigate Newborn Screening are here as resources to provide additional education to the families who aren't able to receive it because of those shifts. Yeah, I think we have heard some instances of some loss to follow-up for second screens, as you mentioned in Washington, but I don't have any statistics on that at this time, but I would be happy to do a little research and get in touch with you on that specifically. Okay.
Can
ahead.
I just, sorry to interrupt, but just one comment. So one of the things that, well, two comments, sorry. So for spinal muscular atrophy, when spinal muscular atrophy is screen positive, that's considered an emergency. And to my knowledge, the healthcare referring centers and the state labs have been very good about making those referrals very quickly. And the referring centers have been very good about getting those families in as soon as possible, which typically is 24 to 48 hours. I had another thought, but now I forgot it. So keep going. Sorry, Annie.
No problem. Okay. So another question, and please, Mary, please do feel free to hop back in if you remember your thought there. But we'll move on to the next question for the time being, which is also for you. Would you be willing to share the COVID-19 impact questionnaire? It would be nice to harmonize any questionnaires that are out there. Yes,
of course. My email is mary@karisma.org.
Yes.
Right, or we can go through Annie.
Yes, you can feel free to email me, but I will also put Mary's email in the chat there. But also feel free to contact me, and I can shoot you an email with an introduction and a connection there. Okay.
I remembered my other thought, and that is that one of the things that we are seeing in our community that is of note to us is that, you know, because only we're now at 60% of infants with SMA being identified by newborn screening, which means that there's another 40% out there that they have to develop symptoms in order to be diagnosed. And diagnosis typically is a presentation of a baby who is not meeting developmental milestones. And what we're seeing is a trend of decreased number of families contacting us as newly diagnosed families. And we have significant concerns that babies are not getting their scheduled follow-ups in the first 2 years. And I think the American Academy of Pediatrics has also really pushed out to pediatricians to make it possible for families to safely be evaluated on time and receive immunizations on time.
Thank you. Okay, so I have one question for us as a group because I'd love to be able to highlight this piece. And I'll allow Mary and Candace, please feel free to answer first, and then I can add a little bit here. So how can all of our attendees here on the webinar, both families and partners, come to partner with each of our organizations to serve families and either in their communities or other families that they know during COVID-19? Like, what are those opportunities for partnerships?
This is Candace. I think a lot of opportunities have presented themselves already, and I'd like to see them continue. I think it's been exciting to see early interventionists and other organization stakeholders in our newborn hearing community really rally together to work with parent leaders from parent organizations, knowing that they've got their finger on the pulse of what's happening, and seeing them as some way to get information back quickly in something that emerges so fast like COVID has. So I hope that that those relationships that have been formed are sustained, and that value, I think that's been raised up by accessing those family leader and family organizations continues to go on. So I'm excited at that prospect.
And I echo what Candace just stated. I am very pleased and amazed by all the innovations that have resulted out of necessity because of the COVID-19 situation. And I hope that we continue to find new and creative ways to continue to link our communities. I mean, to me, that's the thing that I've lost the most, is just that sense of being connected to others. And so if we can continue to work together to continue those connections, number one, we'll all get through this. We will get through this COVID-19 time. But if we don't have to reinvent wheels and we can share our successes across our organizations, we'll just be much better at doing this work.
Agreed. And I'll actually echo a little bit of those sentiments as well, because I think during this time, there's a lot of fog of messages. Everyone's trying to communicate a lot of health messages out there at this point in time, so it's really hard to be able to cut through all that noise. And I really think that the opportunities to partner for all of us together to elevate those messages can help really drive home the important points. For us, if any of you are really interested in getting involved in that work specifically, we are always looking for partners, particularly around our Navigate Newborn Screening module, for people to help disseminate that. I know several attendees on this call today are involved in that work, but we're always looking to get in touch with local organizations or even parents who have access to local parent groups around them, so we can really kind of approach that communication from trusted sources like within large or smaller communities. So please feel free to get in touch with me if you're interested in that, and we would love to have your partnership. Any additional points on that question? Okay, so I see that there is a message in the chat here from Shelley Bowen mentioning that looks like the Bar Syndrome organization is hosting online yoga 4 days a week at no cost to groups in the rare disease community, which is excellent. I am certainly a huge fan of online exercise classes at this time, such a boost for your mental and physical health, right? So if anyone's interested in that, yeah, I will be attending, Shelley. I can send you that link or connect you with Shelley through our offline. So please feel free to shoot me a message or an email. Okay, so I think that brings us to the end of the questions that we've had through the chat so far. Please let me know if I have missed one or if somebody else has an additional question. Please feel free to shoot it now. We'll give a few seconds to see if anyone sends anything through.
So what I see a comment there from Amy regarding also seeing a decrease in neonatal childhood immunizations. Just to, the support has to happen on both sides. For families to feel supported and safe in going in, and then for the healthcare providers to also offer a safe environment for families. What I think has been helpful in our community is to encourage families to call ahead to the physician's office or the primary care provider's office, just to talk through what safety measures have been implemented, like avoiding the waiting room, pre-registration over the phone process, when you come through the door that you're escorted right into a clinic room, those sorts of things. So just to reiterate that it's just so important that immunizations happen in a timely way. No one wants to see an outbreak of something we can immunize for.
It's definitely always a struggle during any sort of emergency situation, making sure that kids and adults out there are getting the immunizations that they need. Okay, go ahead, Candace.
Yeah, this is Candace. I just had one more thought about telehealth. And I know that I've heard some other reports of providers having everything set up and then the parents aren't interested in participating. One thing that we're working on at Hands and Voices is actually sharing positive experience with telehealth from some of our family leaders. And so that's something that we're going to be distributing widely is those positive experiences and how it really can work and the benefits and the outcomes and how easy it can be and some things to overcome those barriers. So that's one other thing I hope that people think about is working with those parent leaders and parent organizations to address some of those issues. So if you're having something, turn to your parent organizations. It's very possible that they have a strategy already in place or that they could develop to try to overcome some of those issues that you're facing.
Yeah, and another additional telehealth resource that we have from Expecting Health actually is a recent webinar that we did for the National Genetics and Education and Family Support Center, and that link is available, I believe, on Expecting Health's YouTube, which we can follow up with after the webinar. So please feel free to access that if you have any more interest in telehealth resources. Okay, any final comments?
You have one more question.
Mm-hmm. In the chat.
Oh, we do. Oh, yeah, great. Great. How do you think the connectedness and support work you have all embarked on should continue post-COVID? Do you see much of this virtual work continuing? I'll let my colleagues here answer that first, and then I'll jump in.
That is a great question, and we're thinking about that as well. So one of the things for Cure SMA that has come out of this is that we've developed confidence and the skills to do virtual meetings and conferences. And those have been, and we've been able to reach people who typically can't come to our in-person events for a variety of reasons. So I think having that flexibility of providing information in different formats is a tremendous skill. And I don't know that we would have embarked upon it as readily as when we were essentially forced to do it, or there was definitely an essential need to do it. So we as an organization are thinking about essentially what have we learned and what can we bring forward as we move past our current situation. Thank you.
And this is Candace. I would also echo that. And I feel like Hanson Voices headquarters has offered a lot of virtual opportunities for our parent leaders. I think now we're seeing the impact of COVID kind of really reaching into the local, state and territory parent organizations that maybe offer in-person events mostly or only, and then really are now pushed to doing online and learning and developing platforms and strategies to do those virtual outreach activities. And it's really also educated a lot of people, and I think the public in general, about access for people who are deaf and hard of hearing, and ensuring that there's access through captioning and interpreting like you've offered today and things. So, so I think there's some really positive long-term outcomes from this.
Great, thank you both. And from our perspective at Expecting Health, we do really think about this question often long-term because many of our programs are online-based. Our Navigate Newborn Screening through the Newborn Screening Education Program is an almost entirely online-based program. So that's continually something that will be available throughout the pandemic and beyond, as it's part of our programming. But we do have this question in terms of sustainability long term. As I think many of us on this call are familiar, like that is always a question in public health, and I think there are opportunities to address that through a number of different partnerships, particularly around technical assistance and a number of different other ways. But that's primarily our perspective on that, is how can we do this through sustained partnerships and providing technical assistance and from our knowledge and experience on these levels. Okay. Great. Are there any last questions before we close out? Okay. Great. With that, I want to give one last thank you to Dr. Mary Schroth and Candice Lindow-Davies today for joining us and for your excellent perspectives. We appreciate your partnership. And I do want to say a thank you to our ASL interpreter for providing her services today. Great. So finally, here's my contact information for any questions that you may have. Please remember to follow along with Expecting Health for new information and resources from us, as well as our partners like Cure SMA and Hanson Voices. We love to share resources, so please shoot me a message if you have something that you'd like to share with our networks. So I want to thank everyone for their time today. Please take care of yourselves and stay safe and well during this very difficult time.
Thank you very much.
Thank you.